Dr. Raghuram, President, the Association of Breast Surgeons of India, Director and Consultant Oncoplastic Breast Surgeon at KIMS Usha Lakshmi Center for Breast Diseases, located at Krishna Institute of Medical Sciences in Hyderabad. World over, since 1991, precisely 24 years ago, October has been designated as the International Breast Cancer Awareness Month. In 1991, Evelyn Lauder, who is the founder of the Estee Lauder group of companies, there was a breast cancer diagnosed within the family. Since then, the Evelyn Lauder, who is the founder of Estee Lauder group of companies, generated the idea of pink ribbons and distributed these pink ribbons across the Estee Lauder group of companies in America. And October, world over, since then has been recognized as International Breast Cancer Awareness Month, with pink ribbons being distributed across America. Slowly, this campaign caught on world over, and since the year 2000, prominent buildings and historic buildings have been illuminated in pink to generate the curiosity amongst the people visiting these monuments, to represent, to basically highlight the issue of early detection of breast cancer. So since 2000, over the last 15 years, every year in the month of October, prominent buildings are also illuminated in pink to create awareness about early detection of breast cancer, and equally salute survivors and their families in the fight against breast cancer. In India, more than 60% of breast cancers are diagnosed in the advanced stage, and majority of them succumb within a few years of being diagnosed. Due to lack of awareness and the fact that breast cancer is a taboo, a closet issue in most parts of India, and due to the absence of an organized national breast cancer screening program, the vast majority of these cancers are presenting in the advanced stages where very little can be done to save lives. The other feature about breast cancer incidence in this country is that compared to the West, where breast cancer is more common after the age of 50, in our country, breast cancer is being increasingly diagnosed a decade earlier, that is between the ages of 40 to 50, making it a significantly different disease in this country compared to the Western world. Breast cancer care is delivered by general practitioners, general surgeons, surgical oncologists, medical oncologists, and radiation oncologists. Although surgical oncologists deal with patients presenting with breast cancer, in India, even today, the vast majority of breast cancers are dealt by general surgeons. In the West, breast surgery is a distinct subspecialty. The concept of breast centers has been firmly established because there is ample evidence to suggest that women who are treated in breast centers by dedicated breast specialists have a significantly better outcome compared with those who are treated by general surgeons or generalists in terms of surgical oncologists who manage all types of cancers. So, in an effort to improve the delivery of breast health care and indeed breast cancer care in this country, for the very first time in the year 2007, I established a freestanding, purpose-built, comprehensive, dedicated center for breast health at Krishna Institute of Medical Sciences. This is not a cancer center. This is a breast health center where the vast majority of women who present with breast health issues go home reassured. As 9 out of 10 breast lumps are not cancers, the vast majority require reassurance. Normally, when someone presents to the hospital with a breast health issue, they are seen by a consultant in one place, and they have to go to the radiology department for a mammogram and an ultrasound scan, and then a needle biopsy, which may be done elsewhere. In the breast health center established at KIMS, which is the KIMS Usha Lakshmi Center for Breast Diseases, the entire assessment relating to a breast health issue happens in one purpose-built place. Clinical breast examination is done by a specialist breast surgeon. Imaging is done by a dedicated breast radiologist, and image-guided biopsies are done also by the dedicated breast radiologist, and the triple assessment is completed within half an hour with reports being given to the patient. The vast majority leave the breast center reassured. Another important aspect is people in this country do not like to go to a cancer center for their screening tests, and the word cancer center can put away patients. So the concept of a breast health center is essentially to reassure the vast majority of people who are worried that their breast health issue is a cancer, but indeed it is not, by way of triple assessment and counseling, which is really emphasized in the breast center concept that was established at KIMS. Conventionally, mammography is the best screening method to detect early breast cancer. However, in the recent times, digital mammography has been introduced, and the KIMS Usha Lakshmi Center for Breast Diseases was the first center in the private sector and the second center in the country after Tata Memorial Hospital to have introduced the concept of digital mammography. The advantages of digital mammography is that there is less discomfort for the patient, even less radiation for the patient, and superior accuracy at picking up very early impalpable cancers. In our country, where vast majority of breast cancers present in young women, digital mammography scores over conventional mammography at picking up very early subtle changes in young women. And most importantly, with a digital mammography, the images can be transmitted anywhere across the world through teleradiology to get a second opinion. Breast screening is not an organized setup in our country. Unlike the West, like the United Kingdom National Health Service, or in the United States where the insurance drives the screening, in India we don't have a national organized population-based screening program. The vast majority of people go for centers to get their mammogram done as part of their routine checkup. Mammography as a way of screening, population-based screening, is not effective in our country. Firstly, because it is expensive. Secondly, there is a huge variation in mammographic reporting in our country. And thirdly, we are a young nation. 87% of our population are young, are less than 50 years old, where screening mammography is less effective. It is more effective in women over the age of 50 years. So in an effort to find Indian solutions to Indian problems, particularly in rural parts of Telangana and Andhra Pradesh, Usha Lakshmi Breast Cancer Foundation, which is a not-for-profit organization, a charity, a breast cancer charity, which has my mother's name associated with it, who is a breast cancer survivor, has implemented or is currently implementing the country's largest population-based breast cancer screening program. Some 1,76,000 underprivileged women between the ages of 35 to 65 years, spread across 3,900 villages in 15 districts of Telangana and Andhra Pradesh, have been screened for early signs of breast cancer by way of clinical breast examination, a screening tool where the foundation has so far trained about 3,400 healthcare workers to examine women's breasts. Although screening mammography picks up cancer as small as 0.5 centimeter, clinical breast examination can pick up cancers as small as 2 centimeters. In a country like India, where the average size of presentation is 5 centimeters, picking up cancer at 2 centimeters and having the ability to empower and educate these underprivileged women is a big plus point through this screening program. And therefore, now Usha Lakshmi Breast Cancer Foundation is now going to be partnering with the government of Telangana and Andhra Pradesh to ensure that we implement this screening program to cover the entire population of these two states, where women between the ages of 35 to 65 will have been screened by way of clinical breast examination, particularly in rural parts of Telangana and Andhra Pradesh, where this will be very effective and we would hopefully serve as a benchmark for the entire country. As the president of the Association of Breast Surgeons of India, that represents general surgeons, surgical oncologists and plastic surgeons practicing the art and science of breast surgery in this country, I have set myself two main goals. The first goal relates to training surgeons. Now, in our country, as I mentioned before, we do not have dedicated surgeons practicing breast surgery. So, we'd like to develop and fill this skill gap by training surgeons in performing not just routine breast surgeries, but advanced oncoplastic breast surgeries which involve reshaping of the breast after breast cancer surgery, both immediate and delayed. And in this context, I have already been in touch with the Association of Breast Surgeons of United Kingdom, where the Association of Breast Surgeons of India identifies through open competition highly motivated surgeons at the end of their higher surgical training, and we intend to send them to United Kingdom for a specified period of 1 to 2 years so that they get exposed to specialist breast units in the United Kingdom and learn and hone their skills and improve their skills in breast surgery and come back home and improve, contribute towards developing breast surgery as a subspecialty in this country. The second component that I would like to now focus is on finding Indian solutions to Indian problems in terms of particularly early detection of breast cancer. If I am able to implement these two goals during this 2-year period, I would consider myself very successful.